Thanks for staying with us. For the first time today, we're getting a better look at what the state believes schools should look like in the fall.
We have team coverage of the plans, including what options school districts have, plus how it compares to the CDC guidelines and what doctors think of it. We start with Mark Kane, who has more on the state's Education Forward plan.
Charlotte and Eric, these are just recommendations, and each school district will come up with their own plan based on their county health plans. The state suggests that each district be prepared to shift between in-person, physically distant and virtual learning. Officials provided 4 examples of scheduling scenarios as part of the plan. In all scenarios, they suggest trying to reduce the teacher-student ratio to 10 students to each teacher, spreading kids out across traditional classrooms, outdoor learning spaces, and even community spaces to limit big groups. And they only have kids learning in class 4 days a week, with the 5th day set aside for deep cleaning, the school's teachers' development, and for independent study. So here are those examples. In one, kids are simply in the classroom 4 days a week, spread out with virtual learning that 5th day. In another, all students report to class 2 days a week and learn virtually the other 3. One example would have half of the students report to school for 4 days a week, while the other half learns from home. They would switch who is in school every week. And in the last scenario, only elementary school students go back to class, spread out across all district buildings. All secondary students learn virtually. Some of the recommendations we expected, like rearranging desks to be socially distant, limited sharing supplies, and making sure disinfectant is widely available. And again, these examples are only recommendations. Eric and Charlotte.
Mark, thank you. These state guidelines come just a month after the CDC released its own guidelines for schools.
Our Gabriela Becerra joins us live to explain how the two plans compare. Gabby?
The CDC and DPI plans are similar, suggesting a lot of the same guidelines to keep students physically distanced in classrooms this year. But the state plan dives a little bit deeper into what that could look like. With over 400 schools in the state, Senior Policy Advisor Jennifer Camerood says each district has a different reality. So these guidelines might not be realistic in each setting, but they should serve as a place to start conversations with local health departments to determine what's a best fit in their communities.
It's something school districts are going to have to plan for now that they've learned from what happened last spring, and think about what's going to work for their community in terms of learning options should they have to go to a remote or virtual setting. And one of the things that I want to stress is we do expect students back in school in the fall.
Camerood says the first plan should be what schools look like with students back, and backup plans should be alternative plans if the local health department orders for schools to close. The Department of Public Instruction used the CDC guidelines kind of as a reference point in creating Education Forward, but they worked very closely with the Department of Health Services. And Amy Reed spoke with health experts to see what schools and parents should consider.
Right. Public health officials have only had a few months to study this virus, but they can also apply what they know about how the flu spreads in schools. A research team at the UW has tracked flu spread in Oregon schools since 2014. They've noticed when kids go on break, like winter or spring breaks, flu-like illness numbers go down. When kids go back to school, respiratory infections rise, not just in school-aged kids, but also in the rest of society. Scientists aren't sure yet how kids going back to school will impact the coronavirus fight, but experts I talked to today said it should still be done carefully.
Worst case scenario, you bring kids back together again and you don't do much. And we see things ramp up very, very rapidly and much greater than we've seen so far.
One thing Tempe said he could tell from this year is when school let out in March, respiratory infections across the board decreased dramatically. He said until there's a vaccine or good treatments, social distancing or distance learning will be key. And other public health experts tell me that the need for that could change quickly as districts react to the change in case numbers. And they said that's going to require patience and grace from parents and employers as the need for kids to be home changes.
Amy, thank you.